I'm welcome. I'm trying to learn medicine today, Amoebiasis, and after we've done that, we're going to do martial arts basic training. And if you participate in the martial arts basic training, then it's very on risk. And we're talking about a disease and a parasite disease, I think. So, yeah. And also internal anatomy and faces, and this is no medical advice, we're just reading about it. Amoebiasis, a parasitic disease found worldwide, but more commonly in tropical countries. Okay, it is a disease caused through a parasite. It is more commonly in tropical countries, but it's worldwide. The infection is spread by food or water which has been contaminated by flies carrying the germ from human feces. Okay. There are flies, and it could be that they were at human feces which had this amoebiasis, and now these flies are flying on and going onto other water or food, and that way it is spread. Travelers to the tropics, especially areas where amoebic dysentery is common. I don't know what it is. Should avoid water unless they know it is being purified. I don't know what it means. And fruit and vegetables from sources where contaminated water may have been used to wash them. That means it can be that people wash the fruit with contaminated water. Okay, the people should take only purified water, and they should take care that the food is not washed with contaminated water. Iodine-releasing tablets added to the water will kill the amoeba, but they cannot be destroyed simply by boiling water or adding chlorine to. Oh, that is interesting. So, it's not purified does not mean boiled, because boiling will not work. Boiling does not work. Can we read it again? Boiling does not work. Iodine-releasing tablets added to water will kill the amoeba. And chlorine in the water, or also boiling the water, does not work. Symptoms: diarrhea. This may be profuse with blood and mucus, amoebic dysentery, or less severe intermittent. Something of that is amoebic dysentery, I don't know, but whatever, diarrhea with blood and mucus. Abdominal cramps, so cramps in somewhere in the abdomen, I don't know exactly. If the infection spreads to the liver, it will produce an abscess which can be felt by the doctor, and the patient will suffer fever, sweats, and weight loss. Okay, it can spread to the liver, and that can make a feelable, what is it called? Whatever, a feelable, I won't use feelable, perhaps something better. A feelable abscess. The patient suffers fever, sweats, and weight loss. Symptoms. Sometimes there are no symptoms, but the patient is carrying the disease and will excrete germs in his or her feces. Okay, sometimes the people don't have the symptoms, but they're still spreading. Duration. Infections may persist indefinitely if not treated. Some people say indefinitely. Infected by amoebiasis causes a parasite called Amoebiasis, which attacks the intestines. Okay, there's a parasite and it attacks the intestines, and it is called Amoebiasis. Treatment. In severe cases, bed rest and replacement of lost fluids are essential. Okay, the people need rest and lost fluids replaced. And to consult the doctor. If there is a severe or prolonged attack of dysentery. So dysentery seems to be the diarrhea of blood and mucus. We're just with C, so maybe we're gonna have it by D. And so if there is dysentery, and if a patient is in an area where amoebic dysentery or dysentery is known to occur. Okay, if the people believe they have it, maybe. Or if they have dysentery. What the doctor might do, check stools for Amoebiasis. I mean the cysts of the parasite. Whatever we're checking. Prescribe an anti-amoebic drug. And we're getting an anti-amoebic drug. Now he's not written off if it works. Okay. That was Amoebiasis. I think it's too early to make a presentation. We haven't done this. This is our first part which we're doing, Amoebiasis. But we have time to go over it again. Amoebiasis. Now it can be transmitted by flies which are on human faces which are in. And if the humans are infected with Amoebiasis, they can then go and swim on the pool or go on the vegetables, and people can eat the vegetables, drink the water, or wash the vegetables with infected water. And even boiling of the water or chlorine in the water doesn't work. The water has to be whatever with some iodine tablets cleared, purified, whatever. And the people who have it, they have severe diarrhea. We have the diarrhea and maybe dysentery, which seems to be diarrhea with blood and mucus. And they can have cramps, abdominal cramps, and maybe if it spreads to the liver, they have a liver abscess, which is feelable. And when they're having sweats and weight loss and fever. And sometimes they don't have symptoms, but they carry it onto other people. And the fault is Amoebiasis, that is the parasite. And bed rest and loss of fluids has to be done, replace the fluids. And if there is basically a suspicion of a disease, consult doctor, or dysentery, consult doctor. When it's analyzed and there are some drugs against it. Whether it works or not, it's not really. Let's go back to the name of the parasite. Amoebiasis. Amoebiasis. Let's stay a bit longer on the name because in the next part will be in the next part of Amoebiasis, when we're trying to do the presentation, this will be the hardest thing. That name, Amoebiasis. Amoebiasis. Entamoeba. Histolytica. Entamoeba histolytica. Oh, there was another 10 seconds. But that was the medicine part. If you were here for medicine, you can go into the next part of medicine. We will do now the martial arts basic training. If you stand, participate in the martial arts basic training, we'll set it down. One leg up and point with the foot on. Then the foot up and down. And circle the foot in that direction. And the other foot up, upper leg up. And bring the foot up and down. And now circle the foot. And now take the leg at the ankle. Make it straight back and point with the knee down. And the other leg. Make it straight back. Point with the knee down to the ground. Now with the ring stop, go with one side. The toes are pointing in front, we are stretching the inner side of the leg. And over to the other side. Again, the toes in front and stretching the inner side of the leg. And now mantis, go from side to side. And back into the leg. And now a few lunges. We're going in front with one leg, and down with the knee, and we're going back. Front, down with the knee, and we're going back. And again with the right leg, back, and in front, back, and two more. And now the shoulder snow plow. Leg up and back, 1, 2, 3 steps in the middle. Up, leg up and back. Up, back. Back, 2 more. And now stretch kicks. Hand out, kick against it. 3 steps. Hold and kick against it. 1, 2, 3, kick. And 1, 2, 3, hand out and kick. Last two. Let's do more. And another two. And maybe right. And now the frog. Leg up. And again in. Up, up. Back, up, in. Up, back, up, and in. And one round more. Up and back. In and up and back. Up and in. And now the Crescent kicks. Kick up and back. And up and in. Up, back, up, and in. And one more time. Last side. And now, lunge kicks. I'm going to kick them close to the camera. So go in front with the right foot, make a lunge down, and kick, and again back. Now the left foot in front, down with the knee, and kick in front, again back. Right foot in front, knee down, and kick, and again back. Left leg in front, and kick. And right foot in front, knee down, and kick. One more time with the other foot, in front, down, and kick. And now squat kicks. Down into squat, and kick to the side. Squat, and kick, and again. Squat, and kick, and again. Squat, and kick. And last two, squat, and kick, and squat, and kick. And swing kicks. Kick in front, back. 1, 2, 3, front, and back. 1, 2, 3, front, and back. 1, 2, 3, front. And 1, 2, 3, swing kicks. And 1, 2, 3, last one. And now, 12 push-up. Down on the floor and hands underneath the shoulders. And bring the elbows close to the rib cage, the first one. And second one, and the third one. And number 4, and 5, and 6, and 7, and 8, and 9. And now the number 10 and 11. And to the last one, number 12. And now the hiker's hilltop stretch. Heel to the ground and pull the toes in. Foot to the left and pull the toes in. Foot to the right and pull the toes in. To the middle and turn the leg from left to right. Other heel to the ground, pull the toes in. Foot to the right and pull the toes in. Foot to the left and pull the toes in. To the middle, move the leg from left to right. Walk on the place. Legs wide apart, pushing up down. And breathe out. Again in. Out. Breathe in, close the legs. And breathe again out. That was martial arts basic training. I thank you very much and until next time.